According to the World Health Organization, the Ebola outbreak in the DRC is spreading at its fastest rate since it was detected about 8 months ago. The current Ebola epidemic is believed to have killed over 600 people and has infected more than 1,000 others, making it the second largest ever recorded. Now, for an update on this current crisis, I'm now joined by Dr. Matshidiso Moeti, who's the Regional Director from the World Health Organization. Thanks very much for joining us. Welcome.
Thank you. Thanks for having me here.
This is quite alarming, the statistics that I've just read there. And when we think about what happened in West Africa, eventually over 11,000 people killed, and this is the second worst on record. This is very frightening.
It is frightening. I think it is serious, and it's demanding massive, first national response by the Congo government and an international response in which WHO is very much involved. I think the context of this outbreak is what is particularly challenging, because it's happening in an area of insecurity where there's been a chronic conflict for years going on there. So armed groups attacking people. It's also an area that's highly populated with intense population movement and at a corner, if you like, of international movement of people as well. So the risk is not only to the northern Kivu province, but also to some surrounding countries.
So tell us what's been happening, because at one point it seemed as if it had been contained and that the number of new infections was actually decreasing. Then there was a sudden spike. What do you think is going on?
It's very directly related to the community response. I think the sense among the people in this area that they had been abandoned for years. You know, they've been victims of this conflict. And this is an area of the DRC as well where the health system is not in good shape. So their access to basic health services has not been fantastic. And what they see from their perspective is that suddenly there's an announcement of this Ebola outbreak, and all sorts of people descend there. We come with our vehicles, with our spacesuits, with requests for them to do things very differently in the way that they live. And you remember that it coincided also with the elections in the country and was somewhat fueled, I think, by some of the sense of not having been involved in the way that they wished in the elections. So at a certain point in time, we had built up cooperation at the community level, and we're starting to see the numbers decreasing, and some of the initial sites no longer had cases of Ebola. Then we had a spate of attacks on the responders, some of the partners who are working, including some treatment centers, and really also attacks on
some of
people.
Them.
Yes, they were torched, some people were killed. And so this has built up the level of mistrust and lack of cooperation. And you know, if you're going to do contact tracing and know who was in touch with so-and-so, who was a case, you need to have people talking to you, and you need to have people opening up to you.
All right, so tell us about treatment, because, you know, when we first heard about vaccines and they were deployed even as far back as West Africa, is it that we're not able to deploy them quickly enough, tracing the people that have the condition? How are we managing with the treatment and dealing with the spread?
Vaccine. I mean, first of all, these are investigational products, including the vaccine. This is not a vaccine that's licensed yet. So we are deploying this vaccine and at the same time continuing to study its effectiveness, and the same for the investigational therapies that are being tried out. Again, all of this depends on knowing who is ill, who is a contact of a person who has been ill, the approach that we are using for the vaccine. And I have to say that the vaccine is extremely efficacious. It's played a very important role in, even if we acknowledge this is a serious Ebola outbreak, in containing it and not having a worse situation. What we do is to target primarily the contacts of a case, and make sure that then we contain in what we call the ring around a case, because simply, as I said, this is an investigational vaccine and we don't have huge quantities of this vaccine available.
So I'm also hearing that a lot of these deaths are happening beyond the treatment centers. So that compounds the problem for you, isn't it? And I don't know that some people don't even believe that it's real.
Yes, it is a matter we have learned, and we are adapting our strategy. It's very much a matter of being in contact with people, building that trust, speaking to people through those that they trust to carry the message, because that will make sure that if in my home we have somebody in the family that we suspect might have Ebola, we raise the alarm quickly. We take them to the treatment center and we show who are the contacts so that they can be vaccinated. And that explains that sometimes people actually do die before the system and the responders are aware of them. But I'm very pleased to say, with this change of strategy, we are more and more working through local groups. I mean, really handing over some of the responsibility for them to run the interventions with the people that they trust. Our job has been very much of late to train them, make sure that they have the skills building up, and to oversee and support what is being done at the community level. We saw, for example, 2 days ago, there were 7 new cases. And yesterday there were 3 new cases. So we've seen a recent spike in the number of new cases per day, but I'm hopeful that very soon we'll start to see again that gradual reduction as we really work through local people in the different intervention areas.
All right, so it is treatable to a degree, so you are getting some successes. Somebody presents, they're found to be positive, but you're finding ways to manage the disease.
Yes, and some people are surviving. The mortality rate is still quite high at 60%, but we are seeing people who actually get ill, go to a treatment center, get treated. Some are getting the investigational treatments, and others are just getting life support treatment to get them through the worst phase of the disease. And there are some survivors, which is something we need to emphasize,
Is it contained geographically? Are we fearful that it might cross borders and travel, or is it still contained at this stage?
It is contained geographically, and here we thank very much the governments of the neighboring countries to the DRC, who very early on, as soon as the alarm was raised, we in WHO and other partners worked with them to reinforce their preparedness. So we've done a lot of work with South Sudan, Uganda, Tanzania, Rwanda and Burundi, just to make sure that the system is on the alert. And they have detected, for example, in the screening of people who are crossing borders, millions of people have been screened. Some people who are suspected to have Ebola have been isolated, and then the appropriate action has been taken to do an investigation, to follow up. So I think on the positive side, yes, this is the second largest Ebola outbreak ever, but so far, fingers crossed, it has not crossed any borders.
All right, well, we'll keep our fingers crossed, and prayers and everything as well.
Yes.
Thank you so much indeed for that update, Dr. Moeti. Thank you so much.
Thank you.
All right.